Let's now talk about the biological mechanisms of photobiomodulation. Photobiomodulation, as you know, acts directly on the mitochondria, which are the structures responsible for generating energy within the cell. In particular, the light is absorbed by the cytochrome C complex, oxidase, an essential enzyme of the electron transport chain. This process stimulates the production of ATP, adenosine triphosphate, the main source of cellular energy. This improves metabolism and accelerates repair and regeneration processes of tissues. At the same time, nitric oxide and reactive oxygen species are released, which function as physiological messengers. Far from inhibiting inflammation, this process helps us optimize it, allowing for a more controlled and efficient response, thus favoring the resolution of the process. This set of effects creates an ideal tissue environment to promote functional recovery and adaptation of the injured tissue. If we look at the action differentiated by wavelength, we must understand that this section explains the complementary effects of the two key wavelengths that are commonly used in clinical practice with therapeutic lasers. 810 nanometers is the wavelength that penetrates the tissue and acts directly on the mitochondria, stimulating the production of ATP, the release of nitric oxide and ROS, and the restoration of energy balance. These effects facilitate cellular regeneration and a regulated and adaptive inflammation in accordance with the physiological state of the tissue. In contrast, at 980 nanometers, primarily, we act on the nervous system, both at the peripheral level, on the receptors, and at the level of what would be the root ganglion, dorsal. This results in the blocking of nociceptive signals, a reduction in inflammatory markers associated with pain, and stimulation of endorphin release, which improves the sense of well-being and allows progress in active treatment. Therefore, the therapeutic combination in the joint use of both wavelengths allows us a more complete clinical response. It works on both the biochemical processes of the tissue and the modulation of pain, always maintaining a functionally efficient inflammation that, not inhibited, promotes the healing and adaptation of the patient.